Hi everyone, welcome to Patho Decipher. So today we are going to see a short content about lipoma. So it's nothing but have you ever felt a soft, squishy lump under your skin? So relax. It's nothing but an universal tumor known as lipoma. So where it's called as a universal tumor because it occurs everywhere in the body except brain. And it's also a benign tumor which arises from the adipocyte tissue. Most commonly, it's a benign mesenchymal tumor in adults. So think of lipoma as a fat cells which has gone crazy, okay, due to some tiny X mutation which is happening in the genetic level. So that's why the adipocytes will start proliferating. So what are the synonyms? It's also called as a fatty tumor, adipocyte tissue neoplasm, and it usually presents as a soft mobile lump. Clinically, it will present like a soft lump. So coming to etiology, so what makes this fat cells to drive crazy? So it's just a tiny genetic mix-up by the chromosomal rearrangement involving 12q 1315. So there will be activation of this HMG A2 gene. So that's why the lipoma cells, all the adipocyte, mature adipocytes will start to proliferate. So that is the main pathogenesis in lipoma. So coming to the variants, it's also like with the different genes like chromosomal 16, 13q, 6p and 8q, 11, 13. So all this involves. So there will be a certain lipoma will have certain fat bodies, right? So like that you have obesity and trauma, hereditary syndrome which is associated with lipoma. And also syndromic association is also very seen, like familial multiple lipomatosis, Maitland's disease, that is a benign symmetric lipomatosis it's called as, and also the Gardner syndrome where it also present with intestinal lipoma and along with osteoma. So next coming to the soft the soft tissue tumor, that is your lipoma. What are the common sites? Okay, lipoma has a favorite zones. So those are your neck, shoulder, arms, back and thighs. So like a deeper location, it goes to intramuscular, retroperitoneal, mediastinal and intra-abdominal. Rarely in visceral structures like, colon and kidney. So grossly, how does the tumor appear? It's like, a mini butter blobs, just like that. So it will be a soft, lobulated, yellow mass where it resembles like a normal fat. It's often well circumscribed and encapsulated. The size will be varying from few millimeters to several centimeters. So the curved surface will be like a butter where it will be a soft and glistening and greasy yellow. So its consistency is like a Duffy. So coming to histopathology level, at MBBS level, you should know it's an encapsulated tumor where it composed of lobules of adipocyte, where there will be a separate lobules along with a mature adipocyte tissue which will be separated by your fibrovascular septae. So that is a classic description for lipoma. So each adipocyte will be large with a clear and peripherally placed signet ring site kind of appearance of nucleus. So, and we told before only there will be a lobules which will be separated by your fibrovascular septa. So there will be no cellular atypia, no mitosis, no trauma, nothing, no aggression, no invasion. It's just a benign tumor. So they may have a thin wall capillaries in between your fat cells. So coming to PG level history, like detailed histology, you should know it's, as I told already, it's a thin fibrous capsule surround the tumor where it can infiltrate into your muscle also. It's called as intramuscular lipoma. And the architecture, how does the architecture look? I told you like it will be a lobules separated by thin fibrovascular septa, similar to that of normal fat where it has lobules of mature adipocytes. No atypia will be there. Stroma will be fibrovascular septae which will be dividing all the cells into lobules, and there will be no atypia. IHC wise it will be positive for S100, Vimentin, negative for MDM2 and CDK4, which is a key feature differentiating it from liposarcoma. So that is the most common question will be asked for postgraduate. And coming to the variants, this is the most likely question by all the examiners. So you should know what are the variants of lipoma. There are many. Fibrolipoma, where the prominent will be your fibrous tissue along with the fat globules, and angiolipoma, here as a term angio is there, the vessels, small blood vessels proliferation will be more, and myxolipoma, where as a term myxo, you will see the myxoid, that is your mucoid stroma will be predominant along with fat cells. And the other type was spindle cell or pleomorphic lipoma. So here, the spindle cells will be little along with the ropey collagen. So that's why it's called a spindle cell or pleomorphic lipoma. And the next one is intramuscular or infiltrating lipoma. So where it presents beneath your muscles. So infiltrating the skeletal muscle bundles is called as intramuscular lipoma. So the other one is hibernoma, where it usually occurs in younger individual composed of the brown fat cells. So that's why it's called as hibernoma. So you should know all these types of variants of lipoma. So next, coming to the clinical features, it's a slow growing, painless, soft tissue mass where it slips under the fingers. So that's a sign, clinical classic sign. So it may be like usually a cosmetic concern for the patients. Rarely it will be painful. When the blood supply is high, like angiolipoma or something, then there will be a painful sensation will be felt. So coming to complication, usually it's very rare, but it can press against pressure on your adjacent nerves or vessels. It can cause pain, and recurrence is incompletely if there is an incomplete excision. So if it is completely excised, there is no recurrence also. It doesn't have any malignant potential, but differentiation from liposarcoma is must. Okay, so treatment wise, the surgical removal is a curative one, and liposuction also came nowadays for cosmetic sites, and recurrence is uncommon unless it's infiltrating. So coming to differential diagnosis, as I told you, liposarcoma, normal fat, sebaceous cyst, angiolipoma. So normal fat, it will be diffuse, non-encapsulated, whereas in liposarcoma, it will have atypical lipoblast. So lipoblast are nothing but it's a multivacculated cell with a central stellate nucleus. So that is known as a lipoblast, where it will be positive for your MDM2 and CDK4 positive will be seen. So the next one is sebaceous cyst, where it also has a fat components, and the other one is angiolipoma. So these are the differential diagnosis of a lipoma. Coming to key histological features, differentiation between lipoma and liposarcoma. So in lipoma, you will see mature adipocytes, whereas in liposarcoma, you will see lipoblast, where that will have a multivacculated appearance in the cytoplasm and will have a atypical nuclei. Whereas the capsule will be present in lipoma and it will be infiltrative in liposarcoma. So the atypia will be not present in lipoma, it will be present in liposarcoma. Coming to mitotic figures, it will be absent in lipoma, present in liposarcoma. And IHC wise, only S100 will be positive in lipoma, whereas S100, MDM2 and CDK4, everything will be positive in liposarcoma, which is a key histological difference between these two. So coming to prognosis wise, lipoma has excellent prognosis if there is a complete excision, and it's a very rare, no meds or something. So coming to the mnemonic, you should know, you remember like a fatty, FATY. So that is F for fibrous capsule with septae, and A for adipocytes mature and uniform, and T for thin capillaries within the septae, and Y for yellow lobulated gross appearance. Okay, so PG wise, you should remember the genetic level. So that is your HMG A2 rearrangement 12q1315. There will be upregulation of your adipocyte growth genes will be there, and the key feature to differentiate from lipoma and liposarcoma is MDM2 mutation. So this is the histological diagram where you can see there is a lobules of mature adipocytes separated by a thin fibrovascular septae, and the nucleus seems to be very benign. There is no atypia, no mitosis, nothing is there. So these are few histological image as you see here. So remember, lipoma is acute and curable, and also it's a fatty, not scary or something sneaky. So this is all about lipoma as a short notes along with. So we'll see in the next class with some other topic. Until then, bye bye.